Good morning, my Massy family. Welcome. How are y'all doing today? Hope you and your families are doing really well. I am your host, Audra Mitchell, and as usual, I am happy to be here with you. I hope you told everyone don't disturb you for the next hour because you're spending it with MLI. To those of you joining us for the first time, welcome. In case you're wondering why this topic, well, the month of October is Breast Cancer Awareness Month, and it is marked in countries across the world every October to help increase attention and support for awareness and early detection of this disease. According to the World Health Organization, there are about 1.38 million new cases and 458,000 deaths from breast cancer each year. Additionally, breast cancer is by far the most common cancer in women worldwide, both in developed and developing countries. I'm sure if I asked you how many persons know someone who has been diagnosed with breast cancer, many, if not all of us, would raise our hands. That is why I'm extremely happy to see both men and women registered for this webinar, because we will be addressing both genders today. Now, before I introduce our presenter, just a reminder that questions will be facilitated at the end of the presentation in our Q&A segment. So as usual, you can post your questions in the chat box. So helping us explore today's topic, let me welcome and introduce our presenter, Dr. Asante LeBlanc. So Dr. LeBlanc is a Cuban-born Guyanese living in Trinidad and Tobago and a married mother of 5. She's a general practitioner and has been the medical director of Victoria Clinic located in Trinidad since 2020. She currently serves as chairperson on the board of directors of the Trinidad and Tobago Cancer Society. She is also a medical herbalist and acupuncturist based on her desire to offer patients a more holistic approach to healing and wellness. So, without further ado, I place you in the more than capable hands of Dr. LeBlanc. Dr. LeBlanc?
Morning, Audra. Morning, everyone. Morning to the Massy team. Let me make sure I do this thing right, since Audra has me working hard, and Jamon is going to do me something if I do it wrong. And Audra, my clinic has been open since 2010, not 2020, but I forgive you. So morning, everyone. It's a pleasure to be here. So today we're going to talk about breast cancer and breast cancer awareness. The Trinidad and Tobago Cancer Society is happy to share any information with you, so we'll get right into it. Let's start off with what is cancer. Cancer is a lifestyle disease. It's a non-communicable chronic disease, or an NCD, and in its own right, it is a pandemic. Cancer, I like to tell people, is a bunch of bad behaved cells in our body. But if you listen to the direct definition, it is a term used for diseases in which abnormal cells divide without control and are able to invade other tissues and sometimes have function. It's not just one disease, but it's many diseases, and there are more than 100 different types of cancers. Most cancers are named for the organ or type of cell in which they start. So today we'll be discussing cancer of the breast. What does it mean when we say abnormal cells that divide without control? Very simple. Imagine that your body is programmed. Every single cell in your body is programmed a time to be and a time to die. It's just clear. And the classic example that we use is the red blood cell. It has 120 days of life and it has to die. When your cells die, it's called programmed cell death, or apoptosis. And when that happens, it is cleared out of the body with different cells called macrophages and phagocytes. Now, if a cell gets damaged, if something goes wrong, our body is programmed to recognize that cell as being abnormal and clear it. What is cancer? Cancer is when something goes wrong along this pathway. be it that a gene has been turned on and the cell has lost its ability to die, and so it just keeps growing and growing out of control, or a cell is damaged, lost its ability to die, has achieved abnormal function, changed its regular function, and your body is unable to recognize it as something is going wrong and cannot get rid of it. That, in a nutshell, is what cancer is at a cellular level. We have two types of tumors in the breast, the benign tumors and the malignant tumors. Benign tumors are those that are not cancerous. They're very rarely life-threatening, and they often can be removed, and in most cases, they won't return. They don't spread to the other parts of the body. So we have two types. We have fibroadenomas, which are more solid tumors, and we have fibrocystic breast disease, which are, as they say, cysts. And these are less solid, and we actually can take the fluid out of the cysts, and we prefer to have simple cysts. So those are benign tumors. So young girls, even young men and older women can have benign tumors, and there's no problem. We follow it up normally. What is the problem? Malignant tumors. Malignant tumors, by definition, means it is cancerous. It may be life-threatening. It can invade nearby tissues and spread to other parts of the body. We have two types of spread, local spread and distant spread, which we call metastasis. When we talk about any disease, it's important to know what are your risk factors. I've already mentioned to you that cancer is a lifestyle disease. So this means that we have risk factors that we can modify and those that we can't modify. So let's start with the non-modifiable risk factors first. Your family history, your genes. It is important for you to know your family history and understand what diseases are in your family lineage. Why do I say this? We know that there are two genes specifically, BRCA1 and BRCA2. And if anybody has seen Patti LaBelle, because I use her as a classic example, you know, all her sisters had breast cancer. So we can do genetic testing and we look for those genes and we know if you have a potential to develop breast cancer. Your family history is so important because if those genes are turned on, then it increases your risk to develop breast cancer. If those genes are turned off, then you have a lower risk of having breast cancer. But it is not on its own. We have to always take everything in a holistic aspect and point of view, meaning it's combined with other risk factors. Your age. We used to say that it was older women, but life has changed because more and more, due to modifiable things such as what we eat, our lifestyle, what we drink, how much we drink, smoking, and so forth, we're now seeing younger women with breast cancer. So age is no longer just about older women. It's also including younger patients, but it is a risk factor for sure. Tobacco use, smoking, everybody knows that they should not be smoking. Excessive alcohol intake. Smoking, I want to remind you that smoking is a risk factor for almost, if not all, cancers. And so it's important for us to absolutely stop smoking. Do not start smoking. Do not vape. Because people think that vaping is not as bad as smoking. But I warn you here and now that it is. It is even at times worse than actual tobacco use because of the chemicals used in vaping. Excessive alcohol intake. Please note I'm saying excessive. That means you can have a little chips once in a while, but you can't drink day in, day out and it not be a risk factor. Sunlight. Oh, we live in the Caribbean. We love the sun. It's amazing. But guess what? We all know that there's been environmental damage or ozone layer damage. And for that reason, the rays that are now hitting us at certain times of the day can actually affect our skin cells. Thankfully, most of us are of African heritage and we have a little more melanin. But don't let that fool you and think that melanin is your protector and you don't need sunblock. So it's very important to understand that sunlight is a risk factor. Any kind of ionizing radiation, so excessive X-ray exposure, excessive gamma ray radiation exposure, that is a huge risk factor. certain chemical substances. So a lot of you would know there's been a lot of lawsuits about Roundup, which is a weedicide that has been coming to Trinidad and Tobago for years. That is definitely a carcinogen. Most of you are young, but back in the day, we used to have asbestos in the buildings. That was a huge, huge risk factor. And we did a big drive to get rid of asbestos in buildings. Certain paints and chemicals in paints, they're all possible carcinogenic substances, including some substances that are in food. And I will mention a very famous one, which is MSG, monosodium glutamate, which in Guyana we call ajimutu. Here, I think y'all call it, if I'm mistaken, it's Betson. But they have changed the name. They've done all kinds of things for you not to recognize it, but it's definitely a carcinogen. Other risk factors include your diet. This is going to be a huge problem because all of us are trying to either eat clean or not eat clean. Who wants to be an omnivore, a herbivore, plant-based versus animal-based? But your diet must be balanced. If you have an imbalanced diet, poor quality food, and you don't have good portion control, that's a huge risk factor for cancer, and in this case, breast cancer. Coupled with lack of physical activity and being excessively selectively plump. Because I like to tell people they're not fat, I'm selectively plump. If we're excessively selectively plump, coupled with a poor diet, that is definitely a big risk factor. And alcohol use, which I mentioned before. Other risk factors. The older the woman is when she has her first child, women who have never had children, menstruation before the age of 12, or women who have gone through menopause after the age of 55. All of this is indicative of your estrogen exposure. So we have seen that there's a link between your hormonal system and how it works and breast cancer developing. What are the signs and symptoms of breast cancer? Signs and symptoms is very simple. Symptoms are what one feels, and signs are what your doctor feels or hears or detects using testing. Signs and symptoms, very simple. An appearance of a lump in the breast, nipple discharge, swelling of the breast, an abnormal swelling of the breast, redness of the breast or nipple, skin changes, a rash around the areola or the nipple. All of a sudden, your breast is just feeling different. One is more different than the other. You're just seeing difference in the skin, or you see all those are signs and symptoms of breast cancer. And here we go again. I've just put another slide so you can see changes in the size and lumps. And don't always think that you'll immediately feel a lump, because it takes a while for you to feel that lump, but you must pay attention to your breast every month. You have to pay attention so you understand what you're feeling. Sometimes the nipple used to be everted or outward, and all of a sudden it goes inwards. Inversion of the nipple is also a sign and symptom, a symptom of breast cancer, sorry. Strange breast pain that you're not understanding, and the breast pain is not cyclical. That means it's not coming along and coupled with your period. That definitely, when you have prolonged breast pain, it should be checked out because it could be a possible sign or symptom. You're seeing the skin beginning to look like the skin of an orange. That could be a symptom of breast cancer. You're seeing a retraction sometimes of the skin around a certain breast. That is definitely a sign. Late signs and symptoms include weight loss that you can't explain, fatigue, chest pain, bone pain, loss of appetite or anorexia, low-grade fever, shortness of breath, jaundice, which is when you get yellow, abdominal distension, so your stomach starts to get bigger, headaches that you can't explain, and a decrease in just memory, brain fog, cognitive function decreases. So you know the signs and symptoms, you know the risk factors. Does this mean there's nothing that you can do? Wrong. What is screening and why do we screen? Screening is when we look for breast cancer in a supposedly normal population. So the more we screen, the more we will find. Because I don't know if you remember the movie, The Titanic. But when he hit the iceberg, he only saw the tip and he did not see the entire foundation of that iceberg. And that is why we're screening. Because when you look for a disease and you don't screen, you only see the tip, and it's called the iceberg theory of a disease. When we screen, we are going under to break through that iceberg theory. So we're seeing what is underneath, that is hidden, that has not come to the forefront as yet. So when we screen, we will find more disease because we're looking for it. So if you're looking for something, you should find it, but you will find it in the earliest stages more than likely. And that means early detection. And that gives you a better chance of survivorship. So how do we screen? Breast screening tests that can be done. For women, 5 days after your period, you do your monthly self-breast exam, which I will demonstrate to you in a bit. You may not remember to do it every month. We're all human. We all have lives, but at least try to do it every other month. But it is recommended that every month you palpate your breast or feel your breast and do your breast exams. Your clinical breast exam. Once a year, your doctor, your GP, your family physician, your gynecologist should check your breast every year, doing almost the same thing as you do monthly, but they're doing a clinical exam. And then the dreaded mammogram. The mammogram is basically an X-ray picture of the tissues inside the breast. They can detect a lump long before you even feel the lump. And we start mammograms at the age of 40. But in Trinidad, we can actually start between 35 and 40, depending on your family history, depending on your breast architecture, depending on anything that you may present before you're 40. Now, screening, you should not be afraid of a mammogram. It is not the most comfortable exam, but it's not painful. It is uncomfortable. We do breast ultrasounds as well. Depending on what is seen on the mammogram, we will do a breast ultrasound to corroborate or correlate the result. How do we do a self-breast exam? I think I can be seen on the video, so I'm going, but this is the slide on how you do a self-breast exam. It's very simple. Ladies, you all look at yourselves in the mirror, look at yourself, look at your breasts, hands akimbo, make sure your breasts are relatively the same size. Remember, unless you pay for them, they will never be identical. One is always going to be slightly bigger than the other, right? You do what she's doing in the first one, your hand the breast you're examining, that hand has to be either behind your head or above your head. And you palpate your breast from outside going in, and then squeeze the nipple, and then you go under your armpits. Or you can do this lying down. Very, very important, very easy. Now, what happens when some women, especially in the Caribbean, have lumpy breasts or dense breasts? So you need to know your breast and how it changes during your cycle. So I always recommend to young girls and young women, examine your breasts all through your cycle. Feel your breasts, understand how it feels, understand how it's going to feel during each part of your cycle so you don't get alarmed. Know if you're feeling a lump. Follow that lump up during the cycle to see if it disappears, gets bigger, goes down, starts to pain, stops paining. All very important information so that when you go to the doctor and say, "Doc, I feel a lump," you have information for them, and they're not going to send you home to say, "Could you check on it for me? Is it coming with your period?" You need to be aware of your body. Don't be afraid to speak to your breast, to speak about your breast. Don't be afraid to examine your breast. Do not fear the word cancer. Do not fear any of that. There's a reason we're doing this. How do we diagnose breast cancer? So you've done your screening. Let's say, God forbid, we found a lump. At the Trinidad Cancer Society, we do all of this. So let's say they found a lump. Then the next step would be what we call possibly a biopsy, or we will first do a spot compression if we see something abnormal, which is a different type of mammogram, but it's just that we're going deeper in to see what we're seeing. And then if it's something that we've confirmed that there's a problem, we will do a biopsy. We can do the biopsy via fine needle biopsy, ultrasound guided, or we can do what we call a true cut biopsy, which is where we actually take out a piece of what we're seeing to send to the pathologist. There is how they will come back to us and tell us, is there cancer? Is there no cancer? Men, I don't want to leave you out. Men, I don't want to leave you out. So men have breasts too, and it's important that men understand that they have breasts. Very, very important, because it's not only the men who have what we call gynecomastia or man boobs, but even those who are pumping hard in the gym and have these pecs and stuff. It's important that every once in a while, a man does a self-breast examination, the same way a woman does it. And any lump you find in your breast tissue should be checked. Men who have gynecomastia, or what we call man boobs locally, they can also have a mammogram done if there's enough breast tissue for the mammogram. Breast cancer in men is rare. It's about 1% worldwide, but it still exists. And for that reason, it's important, because cancer is a lifestyle disease. That means men are not, they're not excluded from that. You have a breast, then you possibly could get breast cancer. And it's very important to understand that. So I'm not saying that all men have to do monthly breast exams every time. No, I'm saying be aware that you have breast tissue. Get and just check it just every once in a while. If you feel a lump, don't be afraid. We can work it up for you. So here you go, your self-examination, ultrasound, a mammogram if you have gynecomastia. And if we do see something, then we will biopsy it. Yeah? Treatment for breast cancer. Treatment for breast cancer in Trinidad and Tobago is actually not too bad off, and it's advanced. So we have different types of treatment depending on the staging of breast cancer. We have surgery, we have chemotherapy, the dreaded chemotherapy, hormonal therapy, and radiation therapy. We are talking about breast cancer awareness. This means we are going, when we screen and we have early detection and we have all of this going on, some patients will show up with breast cancer. But it's about giving hope. It's about showing you and empowering you via education and webinars such as this, that there's always going to be treatment. You cannot think that it's the end of the world, that there won't be treatment, that it means death. There is definitely treatment. And the earlier we detect a cancer, the better your survivorship. So can we prevent cancer? I've been telling you that cancer is a lifestyle disease, which means that lifestyle modification is a big and a huge part and pillar of the solution. So how do we do this? Diet, the quality of what we eat, the food that we eat. So it's the quality of food, what we eat, how we eat it. You can't eat too much fast food all the time. You have to cook your own food, local food. I always promote local. COVID has reset our lives tremendously. So everybody making their kitchen garden home, we eating what we used to eat. We need to go back to basics. So it's the quality of what we eat. But then we come to plant-based versus animal-based. Should we be herbivores? Should we be herbivores? Should we not? Excuse me one second. Should we be herbivores? Should we be omnivores? Should we do plant-based versus animal-based? Should we be gluten-free, fat-free, dairy-free, sugar-free, salt-free? What should we do? Ladies and gentlemen, I want you to say, be stress-free when it comes to your diet. Listen to your bodies, understand your bodies. Because even if you decide to be plant-based, you cannot shock your body if you were eating animal protein. You have to do it very slowly. You have to know that no pesticides are being used on excessive pesticides are not being used on your plants. You have to understand how you are eating that plant-based diet. You have to know the nutrients that you're missing that you have to supplement. So don't just jump into it because it's the fad. But I want you to understand that we do have to pay attention to what we put into our bodies. We do have to pay attention. And I'm not a politician, but I am one who thinks we do need to continue to support local and understand our ancestry and what we used to eat, because there's a reason for that. And the food production world has changed drastically. I mean, this is Massy we talking to, right? Y'all distribute it. So know that not everything that seems fast and quick and oh, you remember back in the day we used to have to do this? Not everything that seems fast and quick is good for you. And we need to get back to basics. Exercise, very important. Whatever you like to do, it's important that you have at least 3 to 4 days of some sort of exercise that gets that heart pumping. Coping with stress, be it hitting punching a bag. Don't punch anybody, punch a bag. Yoga, meditation. You have to deal with your stress. And I must implore that we have proper sleep. COVID has impacted tremendously on our lives and our mental health. So this is very important to understand, that you have to empower and build on your stress coping mechanisms and get proper sleep, because this is indeed an amazing pillar to prevention of cancer. Not that it will prevent all cancers, but it's an amazing pillar to prevent most cancers. Breast cancer, as Audra said, is one of the most prevalent breast cancers in women in Trinidad and Tobago. It accounts for the greatest proportion of deaths by cancer in women in Trinidad and Tobago. We unfortunately have had a very defunct cancer registry in Trinidad since 2009. But in our informal statistics from our clinic in the Cancer Society, we have seen about 30 to 40% of positives from screening. This means that we're not changing. We have not made a great enough impact to bring this down. But guess what? We got it earlier and we saved more lives. So we have to keep working at it. We have to keep educating. We have to promote screening, because those are our best tools and weapons against cancer for increased survivorship. So it's not all for naught. It's not a bad situation. It's an amazing place that we're at right now, where we as human beings can be proactive. This is where women, I implore you, make sure, book a date. I do mine on my birthday every year. Get a friend. You know, it's important to understand that screening should not be something you fear. It should be something that you know is your weapon against this terrible disease. So what is ideal in our medical environment? I just put this slide in for you to know that this is what we're trying to do right now in Trinidad and Tobago, to make sure that you don't depend on only one person if, God forbid, you get a diagnosis of cancer. It's about holistic cooperation between all medical professionals. And that means you need a multidisciplinary team, because you need somebody that you can call up during your treatment, God forbid, and say, I want this explained. It means you have a specialist that will choose your regime, the oncologist. It means you have an interventional radiologist who is looking to see that everything is working correctly, doing the correct biopsies. A nutritionist who can help you with your eating habits, help you break through those side effects of chemo and radiation when you have to eat, help you build your body. A health coach, an exercise coach, occupational therapists, physical therapists, counselors, because not only for you, but for your family. And that's what we do at the Cancer Society. We also offer counseling services. Your friends and your family are a huge support network, and we can never forget religious support, as Audrey reminded me at the beginning of this webinar. Ladies and gentlemen, early detection saves lives. We have the technology. The Trinidad and Tobago Cancer Society is here to break that barrier to access to screening services. Please call on us. We're here for you for screening, for education. Don't let this be in vain. Early detection is what will save lives. And please let this empower you to do that. Thank you very much, and get screened today.
You know, so many powerful nuggets there. I mean, one of the things you said at the beginning that I never knew is that cancer is a lifestyle disease. Certainly didn't know that, you know, so thank you for that. So I see we have quite a number of persons who have questions. So I'm going to hand you over to Renee, who will moderate the Q&A section of this webinar. Renee?
Thank you, Audra. Good morning, everybody. Okay, so our first question for you, Dr. LeBlanc, is, my granddaughter had a lump in her breast when she was 1 month old. She was seen by a doctor who said to leave it alone, it will go away eventually, which it did. But is this cause for further concern?
Oh, wow. Taking me back to my pediatric days in Cuba. No, it's not a real cause for concern. She probably had developed breast tissue before time as a baby. So what happens is that you just have to monitor her breast tissue, because she may be at risk of developing breast cysts and other benign tumors, as we spoke about, but there's no cause for concern. What probably happened as well is that her mother For some reason, she got a lot of hormones from her mom. And so she developed a little bit of breast tissue. We've actually seen babies have breast milk when they come out. I mean, it's very rare, and that's due to their hormonal stimulation. So it's nothing to be concerned about. Just make sure you touch her boobs when you're bathing her, and she'll be fine. Because really and truly, they don't develop breasts per se until the adolescence starts to kick in. So it's probably just remnants of hormones from her mother, hence the reason it disappeared.
Okay, great. Thank you. So our next question, women who have a history of breast cancer in their family, at what age will mammograms be recommended for them, since mammograms are recommended from age 40?
I love that question. So y'all making sure I know my stuff, boy. What happens is we say from 40, but if you have had a first degree relative, so like your mom or your aunts that have had breast cancer, it was an aggressive breast cancer and they died, let's say in their 30s, then those women we actually would recommend that they have a mammogram at 35. If you have dense breast tissue, because sometimes we recommend a baseline mammogram at 35. Now, let's say you're younger and there's a lump, and when we do the ultrasound, it really is very suspicious. We may do a mammogram at that time, but generally it's between 35 to 40 that we start doing mammograms.
Our next question, what is the best mammogram to get? Conventional, film screen, or the digital one?
Sorry. To be very honest, technology has changed. And I think we used to be the film screen, but we used to be digitized and now we're fully digital. So I do recommend moving with the time. The digital ones are nice. They have less compression pain when they're doing the mammogram. So I do recommend going with the most advanced mammograms that are available. And the Trinidad Vegas Cancer Society offers the digital as well. So digital is my preference, to be very honest.
Okay, great. Moving on to the next one. What age is considered late for your first child? I think you had mentioned this as one of the risk factors. So this person wants to know what age is considered late.
How old is that woman? I know, eh? My grandmother was a feminist, right? So I told her when I was graduating, I said, y'all fought for this equality business, but y'all didn't fight it right because we still have to work and be women. We still have to make children and mind house and things. I tell you. So I think late for us would be considered anytime after about 37, 40. That is the high risk and that is late. You understand? But that does not mean, and I want people to understand that. It doesn't mean that if you have you meet your partner late. I'm trying to behave, so Audrey, don't put me out. If you meet your partner late, and you decide, look, it's time to have this child and you're 37, it doesn't mean that you're going to have breast cancer. You remember there are factors that come together. So you're looking at your lifestyle, your education, your physical exercise, your diet, your tobacco use, all in conjunction. So I would say don't panic if you're having a child at 37. Don't think that the world is going to end. Remember, it's your body. Our foremothers fought for that right, for us to make that decision. So go with the flow. Just be conscious of that. Try and not be too selectively plump. Mind that you don't have hypertension, diabetes, and stuff like that. So I would say don't panic about it.
Okay, wonderful. Thank you. All right, on to the next question. My husband found a lump in his breast and did get a biopsy. Thankfully, the lump was found to be non-cancerous. Should this lump be checked thereafter? And if yes, how often?
Yes, wow. I'm so happy, that it was non-cancerous, obviously. So if they did not take out the entire lump, I would recommend that he get that lump checked at least every 6 months for at least a year and a half to make sure nothing is happening and probably consider speaking to the doctor to actually take the entire lump out. The reason, and Renee, sorry, I know you're about to talk. The reason I'm saying that is when we do a biopsy, even though we're going in with an ultrasound and we're just pulling out cores and fine needles of that tumor, of that mass, you understand? So if it's a man, I would have said take the whole thing out if possible. You could tell them you Googled it and that you thought you should take it out.
All right, thank you. All right, this next question. What is the approximate cost for a cancer screening at the Cancer Society?
Woo-hoo! Tell Massy to give it to you for free. No, I'm just kidding. A mammogram. I'm sorry, I'm supposed to be professional. So a mammogram is 300 and an ultrasound is 300. But we do have specials sometimes. Like we just came out of one where Scotia gave a 2-for-1, a BOGO. So 2 women went in and they paid for the price of 1. So, but we are the lowest cost, but this is not like Confucius, where cheap thing not good and good thing not cheap. We are very good. And if you have a problem, find me. But the cost is 300 and the ultrasound is 300. And that is the lowest in the industry in Trinidad and Tobago.
Okay, great. Thank you. And our next question. When I had children, I developed several bumps around my nipples. And up to this day, I have clear fluid coming from my breast. Is that cause for concern? And do you recommend plastic surgery to remove the bumps? I hate them.
Oh, okay. I like how she's so honest. So before I answer that, I forgot to tell you that since y'all are Massy, y'all have insurance and your insurance covers your screening, right? So don't worry so much about cost and talk to Amanda and Audra. They should be able to figure something out for y'all, right? So that's my poke for y'all there. But yes, so the bumps that came out, that's a normal occurrence sometimes, especially in women of African descent when they've had a child. The clear fluid, as long as it's from both breasts, usually we say that will stop on its own and it's not a cause for concern, but the liquid should be examined and you should be followed up at least for a year to see how it's going. Should you do plastic surgery for the bumps that you hate? This is where I ask people to love their bodies, because imagine you're going to get put to sleep to try and take these bumps off. And if you're of African descent and you have keloid skin, you might get a bigger scar trying to take off these bumps than just leaving them there. But what I would recommend is you could check with a dermatologist, because there's a branch of medicine called aesthetic dermatology. And sometimes you can do less than plastic surgery, but something like laser removal, and it might be a possibility because we want you to be happy about your breasts at all times. So you could consult with a aesthetic dermatologist for that. But make sure the person is a doctor. Don't go to somebody who is not a doctor and they will do the laser removal. They can possibly do laser removal of those bumps.
Okay, great. Questions are coming in fast and furious. Are mammograms safe to have if you have lumpy breasts?
Yes, that's when you're supposed to have them. I have lumpy breasts. I do mine every year. Sorry, Amanda sent me a message. Yes, you must. You have to do it. That's a big thing when you have lumpy breasts. But most times, be prepared. When you do a mammogram with lumpy breasts, they're going to say dense breast tissue, and they're going to recommend an ultrasound. So it's definitely safe. Let me tell you something. A mammogram don't burst a lump and spread the cancer all over. That's the biggest myth in life. A mammogram will save your life. So just go and do your mammogram and don't be afraid. Lumpy breasts and all. I have lumpy breasts. I ain't dead yet. I've done about 6. Go and do it. No more excuses.
Does the risk of breast cancer reduce if a woman is going through menopause?
Risk of breast cancer reduce. God, all your staff real thinking what they Googling these questions or what? And by the way, Amanda says to tell y'all that they're working on a package for screening for the staff. So I must let you know. You see how I work it for you? Anyways, yes. What was the question, Renee? I lost track.
Does the risk of breast cancer reduce if a woman is going through menopause?
No.
Okay.
So remember, you know your family history. And when the woman is going through menopause, there is still estrogen. So I wouldn't like to put you at ease thinking that after menopause, you could lay back and don't do your mammogram. No such thing. You have to do your mammograms. Let me give you a story, and it's very anecdotal, but it's true. I have a 74-year-old patient, and she was in England, and between England and Trinidad, but she got, her health in England. And she went to the NIH, the national whatever health system in England, and they sent her a card saying, come for your last mammogram because she hit 70, right? She was not going to go because she's like, I'm in menopause, whatever, whatever. You know, that is the mammogram that picked up the cancer. She got diagnosed with early breast cancer at her so-called last mammogram. So it's never comfort. Don't try to comfort yourself and say I hit menopause. You have to do your mammograms every year. Every year. Don't stop.
Thank you for that. Do you need a reference form from your gyno to make an appointment for the screening at the Cancer Society?
Why you gyno? You have a family doctor. Everybody want to go to a specialist. No, but you don't. You can self-refer. You can have it from your gyno, and you can go to your family physician, and they can refer you to the Cancer Society. So those who don't know the Cancer Society doing it, you tell them, Dr. LeBlanc said the Cancer Society screening, and you want to go there. Simple, simple, simple. And the numbers, we'll send it to Audrey, Amanda, and everybody. You go there, and you tell them I send you. And if you have a problem, let me know. No, you don't need a referral. You can self-refer. When you call, they will ask you if you're having your period, because we need to do your mammogram around 5 days after your period. So we do need to know your cycle. So don't think the people want to be all up in your business. It's that we need to know to program your mammogram if you're still menstruating. And remember, they will tell you no cream, no powder, no deodorant, and so forth on the day of the mammogram. Don't worry, you will not smell like a ram goat. You'll be fine. Go and do your mammogram. Easy peasy. You could self-refer. I need to be in myself. Jamon didn't say enough press.
All right, we're moving on to the next question. My friend just found out that she has breast cancer, and it was under the breast nipple. Would that have been picked up in a mammogram?
Right. Sometimes it will be, and sometimes it won't, depending on the size and how skilled the mammographer is, who is the person who does the mammogram, and how skilled the radiologist is who reads the mammogram. So that is why that's why we bring together the self-examination, the clinical examination, the mammogram, and possibly the ultrasound. So yes, it would have been picked up most times, but if not, the ultrasound would have picked it up if she had dense breast tissue.
Another question. So has chemo improved over the years, or do patients still experience the same adverse effects?
Chemo has improved and has not improved. That's a very double-barreled question. It really depends on the type of cancer you have. It depends on the aggressiveness of the cancer, the stage that you're at. And there are newer chemo drugs, and the government is trying to get new ones into Trinidad and Tobago. So we do have newer drugs, but the side effects are, I would like to say that it's important to know that we can prepare the body for the side effects. We can help the body during the chemo and after the chemo as well. So it doesn't have to be all doom and gloom. So yes, the side effects, I have seen breast cancer survivors in our survivor group with absolutely nil side effects. And then I have seen survivors with a lot of side effects. It really is dependent on your body and your individual acceptance of the drugs. And one thing I want to say, Renee, I find that the more proactive we are about our health and exercise and diet, the stronger your body is going into something as traumatic as chemo and radiation, the better you will come out. So there are always things that you can do.
Okay, great. Thanks for that tip. Okay. How would scheduling an appointment work if your period is irregular?
God, all you went on Google, man. You all want to trust me. So if you have something like PCOS, polycystic ovarian syndrome, and you don't see your periods regularly, then when you call, you let them know. And so they won't be able to schedule it direct 5 days after your period. But once you let them know, we would just go ahead and do the mammogram, gauging it. So we would look at how your cycle has been and gauge it from there. Yeah. It's not that difficult to do. Like, I mean, if you get your period twice a year, I mean, we'll do it at whatever month, right? But if you get your period every month, but it's just coming at different dates, we would, or sometimes if we know you get your period every 2 months, we will say as soon as that period starts, give us a call, because then you could schedule after. But if you're like not getting it, it's coming sporadic, then most times we'll try to just do it whenever it's possible.
This next one is a comment and a question. I love the honesty of your presentation and delivery. For those of us over 40 who've never done a mammogram to date, is there any particular advice besides scheduling a mammogram immediately?
Find a good plan and some lips. No, don't worry. Don't worry, you're not alone. So it's just schedule your mammogram. Don't be afraid. Guys, look, I am a doctor, but I am very honest because we have to speak the language of the patients. It doesn't make sense me coming here all hoity-toity on you because it does not make sense. I have to be me and I have to be real with you. If you are over 40, you didn't do your mammogram, yes, I could buff you, I could do all kind of things, but the reality is I still need you to do it. So I encourage you to go. Nobody is going to do anything. It's not, oh God, why you ain't come? No. It's great, you're here. Now is the time to be proactive. It's never too late to start.
Okay, great. So this one is the reverse now. My daughters, age 17 and 14, their paternal grandmother and 2 aunts all died from breast cancer, all before the age of 60. At what age would you suggest that they both start to get screening?
Right. So that's important. It would be good to know what kind of breast cancer all those women died from, right? Because I assume both the grandmother and the aunts are all related, right? But I would say that they have to be followed up. So they need to start having a clinical breast exam. Those girls need to be taught to do their self-breast examinations. They need to have a clinical breast exam because if they have any lump, that lump has to be followed up with ultrasounds. And from there, it will be determined when they need to have a mammogram. But don't be fearful of that. You know, the women died before 60. So that means that we can still go up to 40 possibly. But it's important that your girls learn about breast health from young, know their breast health, do their ultrasounds, do their self-breast examination, speak to them. Just like you talk to them about everything else, let them know how to examine their breasts and take them to their family physician. Remember, before the age of 18, you can be in that room with them at all times. Don't leave your girl children with any doctor, man or woman, without a nurse. If you're not comfortable, you go in there, you be right there during that examination so you understand and the girl understands as well, but let them get examined for sure annually.
Our next question that I'll ask here, what is your opinion on hormone replacement therapy and cancer?
My opinion. Y'all saw I was a herbalist, right? All right, no problem. So really and truly, the generalized medical opinion of hormone replacement is give only if absolutely necessary. Because if a woman is going through menopause and really going through a rough time, then hormone replacement may be the answer for a short-term solution while you work on that woman's health holistically speaking. Yeah. But hormone replacement in a short dose, I find it's not too bad. But we do know that there's a risk for endometrial and breast cancer with hormone replacement. They've tried to tweak it, they've tried to lower the dose, but it is a risk factor. So absolutely necessary, then take it. If not, there's so much more we can do, and that probably would be a whole other webinar for menopause, because menopause is a whole other bundle. It's like a hydra. So, but there's so much you can do, from exercise, what you eat. But you know, I want women to understand menopause is a natural transition. But the more proactive you are before menopause in terms of your holistic self and how you eat, how you exercise, and how you sleep, how you cope, everything about that takes you into menopause much easier. But you have to be proactive and know your body. So hormone replacement, definitely a risk factor, but if needed, then you have to take it. If you could battle through those hot flashes, night sweats, vaginal dryness, low libido, tiredness, mental fog, all them nasty things, hypertension, weight gain, weight loss, all them things, crying 1 minute, want to kill somebody, and next, if you could manage that without hormone replacement, good for you. If you have other options, good for you. If not, and you have to take the hormone replacement even for 3 months, then that's fine. But it is a risk factor for cancers, for gynecological cancers.
So this question is popping up again, so maybe you can repeat it for persons who might have missed it. Can you have the screening done before the age of 45? And then we have a person asking if they should get it at 35. So maybe you can
Right.
just repeat the age again.
So the age range for us is from 35 to 40. So you definitely could have it before 45, and you can definitely have it at 35. Know your family history. Know how your breasts are. If you have dense, so I could share my personal story. I had dense breast. I have dense breast tissue, so I was sent for a baseline at 35, so that they could see what was going on, and then I had my next one at 40. Once the 35 was normal, so you can start at 35, and you can definitely have it before 45.
Okay, we have a comment from Vandana. Her laugh is infectious. I love her.
Oh, I paid Vandana. Vandana, the money is coming.
All right, let me get a next question here. Do you do mammograms as a woman over 40 years old every year until you die?
Not until you die, but I did a year in pathology. So it's important to understand that when you get older, because we have allowed so much technology makes us live longer. Before you used to die at 40, then we started die at 50, then 60. Now we ain't dying till 100 and something. You understand? Except those fools who want to drink and smoke and, carry on and vape and energy drinks and all together, so they die early. So the older you get, you remember the machinery I told you about that's supposed to clear the cells that are abnormal and cell death and all of that? The older you get, the faultier the machinery gets. You can't expect it to work like when you're born. And I don't know how much of y'all remember old-time typewriter. You remember when that typewriter ribbon ran out of ink? And when you press A, you see an S, a D, and all kind of thing because it ran out of ink, and you're pressing and there's a different thing coming up. So the older you get, the more chance of a misspell and a misinformation in the process of protein synthesis, cell making, cell death. So I have seen older people in their 90s die of a heart attack, but you see the cancer starting. So they didn't die of the cancer. So once you start having your mammograms at 40, you have to do it annually. It's recommended annually every year. Some women beg off and they do it every other year, but I'm the chairperson of the Trinidad Cancer Society. I have to tell you what it is. It's every year, right? Have that personal discussion with your doctor. It depends on your history as well. But I would say, honestly speaking, if you have mammograms all the way up to about 75 or 70, then and they were normal, more than likely we would probably say you don't have to do it every year. Just do your breast exams, check it, and we continue to check that way.
This next question is about breast augmentation. Are you in support of breast augmentation? I know this is about breast cancer awareness, but many women are not happy with their breasts. Does breast manipulation put you at a higher risk of exposure to a cancer?
You see, I was born, my grandmother told me I went in the line twice for breasts and for buttocks. So I was born heavily endowed. Breast augmentation has changed over the years, and there are some risk factors to certain implants. So you have to have that discussion with the plastic surgeon. I think a woman should be happy with her body. I think that if you feel you want a D versus a A, then that's your prerogative, but do it safely and have a frank discussion with your plastic surgeon. I mean, I personally could tell you that I have been offered breast reduction and I didn't take it because I found it's too much stress about how often you could raise your hands after the surgery. I was like, well, for that, until I get a need to reduce these, they'll stay right there. I mean, I could tell you that when I got a scare with breast cancer, I said, well, cut both of them off and let me get two perky things that stand up at 60. I still have standing boobs without a bra. But I mean, that's me. But I don't think breast augmentation is a big risk factor if you have a frank discussion with your plastic surgeon. But know if that's what you want to do, understand that these implants can leak, understand that you have to be sure of what's in the implants, and understand that that does not exclude you from breast screening. The mammogram, the plastic surgeon will advise about the mammograms with the breast augmentation, with the implants, but at least the ultrasound will be done. But I do know that we do mammograms on implants as well, on breasts that have implants in them and ultrasounds. Yeah, but I won't knock you. I mean, to be very honest, if you want bigger breasts, then, go for gold, but have that discussion with your plastic surgeon and make sure you know what you're doing.
Okay, thank you. We're running out of time, but I'll just ask this last question before I hand you back over to Audra. I am 27 years of age and currently experiencing several of the symptoms described today that are associated with breast cancer. I also have several persons in my family who are living with breast cancer. My GP did not examine my breast but ruled it out. Would I still be able to do a screening as I do not fall within the 35 to 40 age group?
How old is she again, Renee?
27.
Yeah, you need to find a new GP. sorry. Okay, so let me tell you something. A doctor is like a shoe. If the shoe hurts in your foot, get a new one. You have to be comfortable with your physician. Don't force the issue. But if you know your family history and you have those signs and symptoms, don't go find a second opinion. It is your right as a patient to get a second opinion. Go and talk to another doctor. Let them examine your breast. You do an examination. Let them examine your breast, and at least force the issue of getting an ultrasound. And I mean, I don't know which country you're in because it tell me this is all over the world. So you could, if you do all of that and you're still not happy, you could get my email, send me the results, and I can try and advise you accordingly. But don't take that just so. Don't take it just so. This is being recorded, so I'm going to behave. Don't take it just so. Please explore your options and get a second opinion, and make sure you emphasize the family history and that women in your family are living with breast cancer. I am not saying you have breast cancer, but I'm saying you are one of those women that we need to pay close attention to. So Audra, y'all can give her my email wherever she is, whatever. However I can help, I'd be happy to help.
No problem. I'll share it with her. Audra, back over to you. Thank you, Dr. LeBlanc.
Great. Rennie, thank you for once again, as usual, doing a great job moderating our Q&A. So, just two quick reminders as we wrap up our webinar. Cancer is a lifestyle disease, so ensure as it relates to the breast cancer that you do your screenings in your respective countries annually. It is a must, and we heard all the reasons today why we need to do it, and because it will give us the best chance of being ahead of the curve as it relates to breast cancer. And secondly, as Dr. LeBlanc said, Amanda would have shared with her, and as we know, mammograms fall under preventative benefit, and all territories have access to this. So please utilize this preventative benefit that you have, that Amanda and the wellness teams work so hard to get in place for us, again, to ensure we get ahead of the curve. So on behalf of all of us from MLI, I would like to thank Dr. LeBlanc for taking the time to share her wealth of information, for sharing her infectious laughter with us as well. You know, as many people appreciated it. So we got a bit of breast cancer awareness. We got a little bit of laughter, which is really good for your health as well. It's one of those things listed there. And I'd like to thank the Wellness and Benefits team and you, our attendees, for making the time to be here with us today. Please continue to look out and sign up for other upcoming webinars and programs. Remember, keep safe and keep leveling up. Bye for now, and see you all at our next webinar. Take care, everybody.